Think about what we normally picture when we hear the word medicine. A pill, an injection, an IV bag, maybe a surgery. That's something that comes from outside the body and gets put into it. Now imagine a treatment where the medicine starts as one of your own cells. That's the idea behind CAR T cell therapy. In simple terms, doctors basically take patients' own T cells out of their body, which is a type of immune cell, reprogram them in a lab, and then put them back into the patient's body so now they can recognize it and attack cancer. This matters because it represents a real shift in how we think about medicine. Instead of just using chemicals or radiation to fight cancer, we're now using living cells as the treatment itself. And honestly, that's part of why I want to dig into this topic. I'm studying biomedical engineering with an interest in cell therapy, and CAR T cell therapy is one of the clearest examples of where that field is currently headed. So, CAR T cell therapy is changing cancer treatment by collecting a patient's T cells and it's engineering them to recognize cancer and returning them to the body as a personalized living treatment. So today I'd like to walk you through three things: what CAR T cell therapy is, how the treatment process works in a step-by-step manner, and why it's both promising but also has actual limitations. T cells are a type of white blood cell, and their job is to patrol the body and destroy anything that looks harmful, like infections, abnormal cells. Normally, this system works quietly in the background, but the problem is cancer cells are sneaky and they can sometimes slip past the immune system without really being recognized at all as a threat. So that's the problem with CAR T cell therapy. That's the problem CAR T cell therapy is trying to solve. It's giving T cells a new way to actually see cancer. And that's where the name comes from. CAR stands for chimeric antigen receptor. Think of a receptor as a sensor on the outside of the cell, And in this therapy, scientists engineer T cells to carry a brand new receptor, basically like a search tool, almost like giving a cell a GPS or a tracker to find these cancer cells. And most of the time, we're used to thinking as the immune system as automatic, like it runs in the background without us thinking about it. However, CAR T cell therapy makes this different, as scientists are literally taking a piece of that system, redesigning it, and setting it back to work. And sometimes scientists and researchers call this a living drug. Now that we know what therapy is trying to do, the next question is, how do doctors actually turn someone's own immune system into a treatment? And it happens through a multi-step process, starts by doctors collecting T cells from the patient through a process called leukapheresis, and the blood is drawn out, the immune cells are separated, and the rest of the blood is returned to the patient. This step matters because it's the foundation of why this treatment is personalized. It starts with the specific patient's own cells, not something that's manufactured from scratch. Next, the T cells go to a lab where scientists genetically engineer them to produce a chimeric antigen receptor, which is the CAR, the one designed to recognize a target on a cancer cells. And once they're engineered, the cells are multiplied in large numbers, so there's enough of them to actually function as treatment. And step 3 is the engineered cells are infused back into the patient. And before that actually happens, patients often go through some sort of chemotherapy first to prepare the body for new cells. And once the CAR T cells are back inside the body, they can recognize cancer cells, get activated, multiply on their own, and start attacking. And that's really the key difference here. Unlike a normal drug, they eventually wears off, these cells can keep working inside the body even after the infusion. So here's a way to picture it. Imagine a security team patrolling campus, but they can't identify one specific intruder because that person blends in with everybody else. CAR T cell therapy is like taking that security team, giving them an exact photo of who they're actually looking for, and then training them and expanding their team and sending them back out. The goal isn't to necessarily attack everything in sight, it's to recognize and take out the right target. And that process is genuinely exciting. It's not simple, so to say, and it's definitely not risk-free, which brings it to the last part. CAR T cell therapy is promising, but it does come with real limitations. On the promising side, it's made a real difference for certain blood cancers, according to the National Cancer Institute. FDA-approved CAR T cell therapies and are currently used for cancers like certain cancers like leukemias, lymphomas, and multiple myelomas. Many of the patients receiving this treatment have cancer that didn't respond to earlier treatments, so for them this can be another shot when other options run out. But there are real risks. One major is cytokine release syndrome, which can happen when the immune system gets strongly activated. symptoms like fever, low blood pressure, and other inflammatory responses. There's also a risk of neurotoxicity where the nervous system itself is affected. So that's why patients are receiving this therapy need really close monitoring. There's also practical and scientific challenges. So far, this therapy has worked better against blood cancers than against solid tumors, partly because solid tumors are physically harder for immune cells to get into, and they tend to have more complicated environments. And on top of that, the treatment is expensive, time-intensive, and highly specialized. So even though CAR T-cell therapy is powerful, it's not simple, one-size-fits-all cure. What I think makes this significant, especially for us as students, is that it shows where medicine might be headed toward treatments that are even more personalized, more biological, and more engineered. Whether you're in biology, engineering, medicine, or biotech, this is a clear example of how those fields are now colliding, pulling together immunology, genetics, cell biology, manufacturing, and engineering all at once. Thank you.